We're talking about recovering from rotator cuff repair surgery. It can feel, really complicated. So our goal here is simple. Cut through that complexity. We want to boil down the medical advice into stuff that's clear, actionable, and honestly, some of it's pretty surprising. We've got a great mix of sources for you today, a full patient recovery guide, specific instructions from a top shoulder surgeon, Dr. Chintan Desai. Think of this as your shortcut to really understanding what it takes to heal that shoulder properly from day one right through to getting back to normal. Okay, let's get into it. So picture this. You're fresh out of surgery. What's the absolute number one thing in those first, say, 0 to 6 weeks? All the sources hammer this home. The sling. It's not just for show, is it?
Oh, absolutely not. It's your shoulder's bodyguard, basically. You have got to keep that arm in the sling all the time.
Even sleeping.
Yep, even sleeping. Unless your doctor or therapist gives you the green light to take it off for specific exercises or moments, it stays on. Think about it. The repair is incredibly delicate right after surgery, like sewing together really fragile fabric. Any wrong move, any stress.
And you could tear it again.
Exactly. The sling provides that stable, protected environment for the initial healing to start. Critically, that also means zero lifting, no pushing, no pulling with that arm, nothing.
Makes total sense. It's pure protection. And how long are we talking for this super strict sling phase?
Generally, you're looking at about 4 to 6 weeks. That time frame lines up pretty well with when the tendon is most vulnerable, the really early healing stages.
Okay. Besides the sling, pain's obviously a big one right after surgery. How do you deal with that effectively?
Right. You'll get prescribed pain meds, and the key is taking them as directed. Don't be a hero if you're hurting, but don't overdo it either. Follow the instructions. And ice packs, they're your friend. They really help with that localized pain and swelling.
How often?
Good question. Little and often is best. Maybe 5-10 minutes at a time. But do it several times a day. Just always put a thin towel or cloth between the ice and your skin. Don't want an ice burn on top of everything else.
Right, good tip. Okay, what about the incision itself? Wound care can make people a bit nervous.
It's usually straightforward, but yeah, you got to be careful. Main rule, keep it clean and dry. And don't mess with the dressings. Leave them alone unless your surgeon or nurse tells you to change them.
Can you shower?
Usually yes, after a few days, but only when your surgeon says it's okay. And even then, you have to be super careful not to soak the wound. Quick showers are okay, but absolutely no baths, no swimming pools, no hot tubs until you get the all clear.
Because of infection risk.
Exactly. Soaking significantly increases the risk. And if that dressing does get wet or soak through somehow,
Call the doctor.
immediately. Don't wait. They might need to change it. And speaking of the doctor, that first follow-up, usually around days 7 to 10 with Dr. Desai for suture removal, that's a really important one. They check how things are looking right at the start.
Okay, crucial first check-in. Now, sleep. You mentioned keeping the sling on, but how do you actually get comfortable? Lying flat sounds painful.
It usually is, yeah. The advice is definitely to sleep propped up for the first few weeks. Think semi-upright.
Like in a recliner.
A recliner's perfect if you have one. Or just build a sort of ramp with pillows behind your back in bed. It takes the pressure off the shoulder, reduces pain, and stops you from rolling onto it accidentally. You keep the main sling on, but you can often take off the next strap bit if it helps you get more comfortable while you're propped up. It's all about keeping that shoulder safe, even when you're asleep.
Got it. So that initial phase is all about protection, rest, and managing pain. It really sets the foundation.
Absolutely. Get that part right, and you're setting yourself up for better success down the line.
Okay, so once you're past those first critical weeks, what does the journey back to, using your shoulder actually look like? It's not just suddenly, okay, right, we're talking rehab.
Exactly right. Rehab is a very structured, phased process. It's not like flipping a switch. It's a gradual roadmap your shoulder follows. And you have to respect the phases because tendons heal slowly. Trying to rush it is, well, usually a bad idea. It puts the repair at risk.
Okay, walk us through those phases. What happens when?
Sure. So phase 1, that's basically weeks 0 to 6, overlaps with the sling time. It's all passive range of motion.
Passive meaning.
Meaning you're not using your shoulder muscles at all. Your therapist moves your arm for you, or maybe you use your good arm to gently move the operated one. It's just about keeping the joint from getting too stiff without stressing the repair.
Okay, makes sense. Then phase 2.
Phase 2 kicks in around week 6 and goes to maybe week 12. Here you start active assisted, that active range of motion. So you start gently helping with the movement, gradually getting your own muscles involved, but still very controlled.
So starting to wake the shoulder up a bit.
Kind of, yeah. Then phase 3, that's usually around 3 to 4 months post-op. This is when you begin actual strengthening exercises.
Yeah.
The tendon's healed enough by then to start handling some resistance.
Right. Building back the power.
Exactly. And finally, phase 4. This is 4 to 6 months and onwards. This is your return to normal activities, normal function, and if you're an athlete, starting sports-specific training, really getting back to life.
That's the goal.
But, and this is crucial, you only start home exercises when your therapist or doctor tells you to, and you follow those instructions exactly. No improvising.
Don't get ahead of yourself. Got it. What about general activity restrictions during all this? Things you just can't do.
Well, definitely no driving while you're still in the sling. That's a safety issue.
Yeah.
Usually driving can resume around 6 weeks once the sling is off and you have decent control, but always check with your surgeon. And throughout the recovery, it's a strict no on lifting anything of significant weight with that arm. No reaching behind your back suddenly, no, jerky or unexpected shoulder movements.
Any other specific no-nos?
Dr. Desai specifically mentions avoiding shrugging your shoulder. That simple movement can actually put quite a bit of strain on the rotator cuff repair, especially early on.
Huh. Interesting detail.
And, of course, no returning to work, especially physical jobs or sports, until your surgeon gives you the explicit green light. The timelines can vary, but roughly, a desk job might be okay around 4 to 6 weeks. Later activities, maybe 3 months. But again, these are just averages.
It's all very individual. How do they track that individual progress? Those follow-up appointments sound pretty important.
Oh, they're critical. They're how the team monitors your specific healing. You'll typically have them scheduled at key milestones, maybe 2 months, 4 months, 6 months, and sometimes even out to 2 years.
What happens at those appointments?
They check your movement, your strength. At the 2-month mark, Dr. Desai often does an ultrasound, a USG, right there in the office.
To actually see the tendon.
Exactly. To check how the repair is healing internally. It's pretty cool. Based on that, they'll guide your exercises. Then at 4 months, they're looking for more improvement in function. 6 months is often the big one for potentially clearing people for sports if things look good.
And you mentioned forms and tests.
Yeah, you'll likely fill out questionnaires about your pain and function and do specific strength tests at each visit. It gives them objective data to track your progress and make sure the rehab plan is working for you.
So it's a very monitored, tailored process. Makes sense. Now, while you're on this path, hopefully smoothly, what are the red flags? When do you absolutely need to call the doctor, right away?
Okay, this is really important. Call your doctor immediately if you get a fever over 101 Fahrenheit or 38.3 Celsius.
Sign of infection.
Could be. Also, if you see increased redness, more swelling, or any kind of pus or drainage from the incision, call them. If your shoulder pain suddenly gets much worse or isn't controlled by the meds they gave you, or, and this is important too, if you develop any new numbness or tingling down in your hand or fingers, that needs checking out quickly to make sure there's no nerve issue.
Good list to keep in mind.
Okay.
We've covered the immediate steps, the long rehab road, the check-ins, the warnings, and underlying all of it seems to be this message. Everyone heals differently.
That's maybe the most important takeaway. Each patient recovers at their own pace. You really can't compare your recovery timeline directly to someone else's.
And trying to push it doesn't help.
Nope. As Dr. Desai puts it, healing the tendon properly is crucial for long-term shoulder function. Patience pays off. And, his experience operating on over 1,000 shoulders, that really speaks to the effectiveness of this structured approach.